So today we're going to explore the role of light wavelength filters, specifically focusing on the blue and violet filters in lens design. We'll uncover the science behind these filters and how they're revolutionizing the way we think about intraocular lenses.
That's right, Zaina. I think we can talk about the possible and the specific benefits, and all, as well as the downside of putting something in an intraocular lens that filters out some light.
So, and we're going to dive into how these filters actually impact the overall visual experience, not just the theory behind it. Because it's not really just about seeing clearly, it's about seeing comfortably.
Absolutely. And I think, when you're a professional in the field or whether you're a student or whatever, there's a lot here that we can unpack. And I think a lot for us to think about going forward as we start talking about what we want to do for our patients.
Okay, so let's start with a little bit of the background. Describe for me the role of light wavelength filters, specifically blue and violet.
Yeah, I'm actually going to go back a step because I think it's important for us to talk about the history of filters in IOLs. Showing my age, the very first IOLs we had no filters, and there was a lot of ultraviolet light that would enter the retina. And these patients would go out on the beach or they go skiing and they come back with erythropsia because of the bleaching of the retina. And it could last 24, 48 hours sometimes. And then the first filters were actually just up for the UV light up to about 400 nanometers. Now, I guess at this point it's good to pause and say, well, what is the visible spectrum? Well, it goes from around 380 to about 750. You can it's just kind of a double 380. It's almost 750. It's an easy way to think about it. And so we had a filter that maybe cut off at about 400, and patients were pretty happy with that. And then what came along was their first natural filter, a yellow filter, that filtered up to close to 500 nanometers. So it got well into the blue. And I think the premise of that was really two things. The first was, can we do something that might protect retinas? And, is there some way that by filtering out that light, it might be protective to the retina? And the reason for that is the shorter the wavelength, the more retinal toxicity. And it's almost a really steep curve going from the blue into the violet, that the more of that hits the retina, potentially there's more photooxidative stress and release of hydrogen peroxide and other things that could be toxic. And so the concern was, we're putting these lenses in younger people. We may put them in people who are outdoors a lot. Is it important for us to filter that light? We haven't seen clear evidence that that's the case, but it is an interesting theory. Well, there are some problems potentially with filtering blue light, and that gets back to the whole topic of circadian rhythms. And one of the most remarkable discoveries in our field was the discovery of ganglion cells that specifically receive light and then feed melanopsin back into the pineal gland to block the release of melatonin. And the thought was that if you block the light getting to them, then you've blocked the circadian change that occurs from going from bright light into low light. And as a result, there was a sort of criticism about whether or not blue filters might be impeding a patient's ability to sleep, have effect on cognitive effects, and all that sort of thing.
Well, it's interesting because when you first started having IOLs, right, before the filters, people were just so amazed by the outcomes. And as we continue going along, then we're kind of working with how to improve, visual outcomes more and more. So what's interesting too, you talk about the blue light filters. I mean, I think with the whole technology of iPads and computers, it's almost like how important is it? Or is it even more important? So any downfalls you think to having these filters in the IOLs?
I think that the downfalls potentially for something that filters up to 500 would be maybe it interferes a little bit with circadian rhythms, although the data are kind of mixed and mostly negative in that regard. Does it interfere with color vision? If I'm going to go to my closet and pick out a suit, is it a blue suit, a navy blue, or is it black?
Right.
Certainly better than when one has a cataract. So that's kind of interesting. And then I think the violet filter story is kind of intriguing as well. And I think we have to then think about what's going on in our environment. I mean, the lights that we have around us now have gone from largely incandescent more and more to LEDs. And the wavelengths are hugely shifted toward the blue and the violet. So when you put a lens in that is maybe has diffractive optics and already creates some glare and dysphotopsia on the positive side, would it be good to filter out the violet light is really the kind of the thing without impeding the circadian rhythms. And some early data suggests that that might be the case. Mm-hmm. My own experience in transitioning from an EDOF that had no violet filter to one that does definitely shows me that there's less glare with that, and that patients have much more visual comfort for things like driving at night when those car headlights, those LED car headlights are blasting at you.
No, and it's interesting that you notice that because it's a little bit difficult to take that one variable out from lenses, especially with all the updates and the technologies. But there's a lot of good theoretical data, so it makes sense that it is improving that.
I think the other thing to think about is the whole thing about Abbe numbers. Mm-hmm. And again, are you somehow improving quality of vision by cutting off that violet end or even the blue end in order to diminish the amount of chromatic aberration that eyes experience? And again, the data are a little bit iffy, whether or not that really makes a big difference. I guess the way I look at it is that there certainly is the effect of all the other stuff that affects sharpness of vision, defocus, higher order aberrations. How much can chromatic aberration affect it? But I think that if we can improve chromatic aberration in those lenses that are more demanding optically because of diffractive optics, trying to get all three ranges of vision, there's probably some logic at least to using it. I don't know that the data have yet shown that benefit.
Yeah, no, I agree with you. I mean, dispersion of light is an important phenomenon when you have everything else perfectly, right? Because if you do have residual, lower order aberration issues, you're not going to really notice the changes in higher order aberrations or the chromatic aberration. So I think it's really important for us to get back to, we're splitting hairs because our technology is so good. But since it is making a difference theoretically, we're definitely noticing that also in the visual outcomes for patients.
Completely agree. Well, I think that we have yet to really unpack all of the information we need about filters, retinal toxicity, quality of vision, what's the correct wavelength, if at all. And I think that this is a topic that will kind of still be on the front burner for a while until we sort these things out. And certainly good for a lot of marketing arguments too.
Thank you so much, Doug, for getting into this, in detail and really giving us the history of it too. Thank you all for joining us on this enlightening journey through the world of lens light filters. We hope you found our discussion on blue and violet light wavelength filters and intraocular lenses both informative and engaging.
Thanks, Zaina. It's really fun delving into this topic because, as I say, it's still kind of emerging, and I think it's something we all have to kind of keep watch on and pay attention to as new lenses are brought out, with or without the filters. And hopefully we'll have more and more studies that will really validate just where's the sweet spot here or sweet spots.
Yeah, I absolutely agree. I think, no matter what, it really is the clinical data that matters. And I think the hard part with these specific topics is how can we really test that separately in patients without all the other things that we're doing. But I encourage you, our viewers, to continue exploring and learning. Whether you're a healthcare professional, student, or someone interested in eye health, there's always something new to discover.
And that's one of the great parts of our field. So it's really been fun talking about it with you.